In this podcast episode, Dr. Chris Palmer and Gary Brecka discuss the mental illness crisis and the connection between metabolic health and mental health. Dr. Palmer introduces the brain energy theory of mental illness, which suggests that mental disorders are closely linked with metabolic dysfunctions in the brain. He highlights the rising rates of mental illness globally, with about 1 billion people suffering from mental or substance use disorders prior to the pandemic. Before the pandemic, approximately 1 billion people worldwide suffered from mental or substance use disorders, representing about 13% of the global population. In Western countries like the United States, about 1 in 5 people experience a mental disorder in any given year, with a lifetime prevalence of 50%. Rates of depression, anxiety, PTSD, and substance use symptoms have been on the rise, with almost 50% of Americans reporting such symptoms during the peak of the pandemic. The United States has one of the highest rates of antidepressant use in the world, yet the treatments are not always effective for everyone. Dr. Palmer's brain energy theory proposes that mental disorders are a result of metabolic dysfunction impacting the brain. He suggests that the mitochondria, the powerhouse of the cell, play a central role in regulating metabolism and brain function. Metabolic dysfunction can lead to symptoms of mental illness such as depression, anxiety, ADHD, and more. By understanding and addressing metabolic health, new avenues for treatment and long-term improvement in mental health can be explored. Metabolism is the process of converting food, nutrients, and oxygen into energy and building blocks for cells. It is essential for the functioning of living organisms. Mitochondria, the organelles responsible for energy production, play a crucial role in regulating metabolism. When cells lack healthy mitochondria, they may malfunction, leading to various health issues, including mental disorders. Mitochondrial dysfunction has been linked to conditions like obesity, diabetes, cardiovascular disease, and neurodegenerative disorders like Alzheimer's and Parkinson's disease. Mitochondrial dysfunction is often fixable, and addressing metabolic health can potentially improve mental health outcomes. By focusing on optimizing mitochondrial function, individuals with mental disorders may experience improvements in their symptoms. Understanding the role of mitochondria in mental health opens up new therapeutic options and treatment approaches that target metabolic health for long-term benefits. Dr. Palmer shares a case study of a morbidly obese patient with schizophrenia who experienced significant improvements in his mental health symptoms after adopting a ketogenic diet. He explains how ketosis can enhance mitochondrial function, improve brain energy production, and alleviate symptoms of mental illness. In addition to conventional therapies like medication and therapy, Dr. Palmer suggests incorporating metabolic interventions to support mitochondrial health and improve mental health outcomes. He highlights the importance of addressing food sensitivities, optimizing carbohydrate metabolism, and reducing stress to enhance overall brain function. He explains that certain nutrients, such as vitamin B12, folic acid, and thiamine, are essential for mitochondrial function and brain health. Dr. Palmer acknowledges the challenges of implementing metabolic interventions in mental health treatment, especially for individuals with severe and treatment-resistant conditions. He emphasizes the need for clinicians who understand the connection between metabolic health and mental health to provide safe and effective interventions for patients. Dr. Palmer discusses the growing interest in the brain energy theory of mental illness and the potential for widespread adoption of metabolic interventions in mental health care. He shares his plans to establish outpatient clinics and research programs focused on integrating metabolic and mental health treatments to improve patient outcomes. He mentions ongoing clinical trials investigating the use of the ketogenic diet for various mental health conditions, and highlights the collaboration with researchers and philanthropic organizations to advance the understanding of metabolic interventions in mental health care. For individuals seeking metabolic interventions for mental health, Dr. Palmer recommends exploring resources like metabolicmind.org and seeking out clinicians who are knowledgeable about metabolic therapies. He emphasizes the importance of working with professionals who can provide safe and effective interventions tailored to individual needs. Dr. Palmer advocates for a multidisciplinary approach to treating mental health conditions. He suggests that a team of healthcare professionals, including psychiatrists, psychotherapists, dietitians, and fitness trainers, should work together to address the various aspects of a patient's health. By treating the whole body rather than just the brain, better outcomes can be achieved. Dr. Palmer acknowledges that mainstream psychiatric facilities may not currently consider factors such as mitochondrial dysfunction and dietary interventions in their treatment approaches. He highlights the need for a shift towards a more holistic and comprehensive view of mental health, which includes addressing metabolic issues and optimizing mitochondrial function. The brain energy theory challenges conventional wisdom in psychiatric medicine by focusing on mitochondrial dysfunction and metabolic issues. Dr. Palmer acknowledges that this disruptive approach may face resistance from established industries and institutions. However, he believes that disrupting the current treatment paradigm is necessary to improve outcomes for individuals with mental illness. Dr. Palmer envisions a future where mental health treatment is more holistic, incorporating dietary interventions, lifestyle changes, and mitochondrial optimization. He emphasizes the potential economic benefits of preventing and treating mental illness effectively, leading to improved quality of life for individuals and reduced healthcare costs.